This portion of Carlos and Lisa is brought to you by Scan Health Plan.
We're back once again with our friends from Scan Health Plan. As you've learned here, Scan is a local nonprofit Medicare Advantage health plan for people who are eligible for Medicare. Our friends at Scan join us regularly to provide important Medicare information and updates for our viewers who are 65 and older. We've heard from them a number of times about the importance of finding a local licensed health insurance agent who can help folks get signed up for Medicare and then help them select the right Medicare plan for their healthcare needs. And David and Holly from Scan are here with us once again. Welcome back.
Hi, Carlos.
On a previous segment with you, we were joined by Dr. Sachin Jain, who is not only a physician, but he's also the Scan Health Plan's CEO and president. And when I asked him what the most important thing that people 65 and over should do at this time of year, you know what he said?
The one thing I would recommend to you as a physician and as the child of seniors is your flu shot.
Well, I did some research, and according to the Centers for Disease Control, flu shots reduce the risk of flu by 40 to 60% among the overall population. And I suppose that is why Scan is advising people on Medicare to get their flu shots.
That's right, Carlos. A vaccination is the best protection against the flu, and doctors recommend that everyone 6 months or older get a seasonal flu vaccine each year by the end of October. Since Scan Health Plan's 220,000 members are folks over 65, our focus is on reminding all seniors of the importance of getting that immunization. Get it now, because getting a flu shot can keep our senior population out of the hospital at a time you really don't want to be there. And it can make sure doctors and other healthcare workers are able to focus on treating the patients who need them most. And the good news for all of your viewers who have Medicare, the shot is free. No deductible, no copay, if you have it administered by a doctor or pharmacist who accepts Medicare.
So Holly, talking about those free flu shots or people on Medicare, some folks are uncomfortable discussing their age. And I know you've been very open about sharing your experiences as a person who receives Medicare benefits. And since you are not shy about your age, we watched you get your annual flu shot, right?
Yes, you did, Carlos. Since I am 72 and a member of the baby boomer generation, you thought it would be valuable if I shared my experience as a Medicarian and how I went about scheduling and receiving my seasonal flu shot. I do get that injection every year because it makes good sense for adults 65 and older, because we are more likely to develop serious complications from the flu.
Like all of her contemporaries with Medicare coverage, Holly had the option of choosing where she got that no-cost shot. We encourage all of our Scan members to visit their primary care physician or go to their local pharmacy to receive their injection, whichever option is most convenient for them. In Holly's case, she chose to visit her primary care physician's office.
I did. And before we show you how brave I was, it's important to point out that I took the appropriate steps for keeping myself and others safe prior to entering the office. I wore my mask. I took my temperature at home to make sure I wasn't running a fever, and I made sure that I washed my hands in the washroom prior to entering the office. As a Medicare recipient and a Scan member, I made my appointment and showed my Scan card and my Medicare card when I checked in. The office staff and the safety precautions that they had in place made me feel confident and safe during my visit. Dr. Fishbein, before you give me my injection, what advice would you have for people over 65 about the importance of getting their flu shot this year?
Especially this year, I'm a really big proponent of everybody getting a flu shot. It's really indicated now in anybody from 6 months of age on up. We're giving high-dose flu shots to people who are over the age of 60.
Oh, really?
And so that's something that we're doing on a routine basis as well. So I think it's extremely important.
As you can see, Carlos, I braved the experience. And one last reminder, a flu shot is affordable, convenient, and goes a long way towards protecting my health and the health of others, now more than ever.
Well done, Holly, and yes, you were very brave and a great example for our viewers. We should also point out that it is currently Medicare's annual enrollment period, where Medicare beneficiaries can enroll in or change their current health care coverage. David, what should we know about this annual enrollment period?
That's a very important reminder, Carlos. This is that time of year when Medicarians should be reviewing their plan options and making sure that they are receiving all the benefits that they're entitled to. And as you know, while we think SCAN provides excellent healthcare coverage and is one of the best options for your viewers on Medicare, another very consistent message to relay to your viewers is about the importance of finding a local health insurance agent who represents all of the Medicare plans available in their neighborhood. Only by working with those independent agents can you be sure that you are signing up for the right plan for your specific healthcare needs.
Using SCAN as an example, is there anything new in your Medicare Advantage prescription drug plan for 2021 for SCAN members?
We've made a number of enhancements to our coverage for 2021, but one that I think is very relevant is for people with diabetes. We've significantly lowered the cost for our insulin-dependent members. For diabetics, they'll enjoy a fantastic cost savings as members of our Balance plan. But again, their local health insurance agent can provide all of the information on the plans and benefits offered by SCAN and all the other plans.
And I think it's important to remind my baby boomer colleagues that there is no charge to them when they reach out to a local independent agent. The agent is compensated by the Medicare Advantage plan that they enroll their clients in.
Well, once again, you've provided a wealth of information for our viewers. We've gotten a lot of positive feedback from Medicarians who followed the advice you both have provided on our previous segments. What will we talk about in our next visit?
Next time we want to address our comments not only to seniors, but we'll talk a bit about the role that a loved one can play in helping someone eligible for Medicare navigate the system. In the same way that we turn to our younger family members to help us with the use of our technology, we'll discuss how those youngsters can assist their parents and grandparents in their Medicare journey.
We look forward to that. Thank you so much for joining us today. We look forward to your next segment. And Holly, congratulations on successfully getting your flu shot and being a great example to all of us. Till next time, stay healthy.
Thank you, Carlos.